Alrighty, here's a question that comes up about bearberry, right? We're talking about Arctocephalus uva ursi. That's another common name of it, just uva ursi. Or Arctocephalus coactylus. These are the varieties that you'll see on labels. Arctocephalus ardentrica. Those are the three most common. And it's sometimes commonly called uva ursi just by itself. So bearberry or uva ursi. And this is a plant that has, as you may already know from my other video, important diuretic properties, astringent, relaxing, antiseptic, antimicrobial properties. From a traditional Chinese medicine, TCM, it's known for clearing heat, reducing inflammation, clearing toxins. Toxins in traditional Chinese medicine can mean anything from viruses to bacteria to funguses to molds, yeast, environmental. It's got just stuff you don't want in your system. Stop bleeding, tissue repair. And the question that comes up is, can you use it daily? And this is generally an herb that's considered very safe, and especially if used as directed. This is always important, but with some herbs it can potentially be more important. It is known as a nutritional supplement and tonic for especially people that have chronic cystitis or really bad bladder infections, and the herb is used for other conditions as well, but that's a common one that it'll show up for. Native Americans, Chinese, European herbalists, they've all used this herb as kind of a go-to. Now, there's some evidence out there, but it's not really conclusive but you'll see it, so I want to cover it, where it says, you don't want to use it for more than 5 days in a row, or you don't want to use it more than 5 times a year, because it could have unwanted side effects impacting heart issues. In general, I think what this points to, because it isn't conclusive, is that it's not necessarily for everyone, but if you're someone who has heart problems and is on heart medications and is having edema, and this is an herb that helps you urinate, it's going to be really moving the metabolism in the system, you want to check with your healthcare provider. And in general, you want to always be doing this. Having a condition and thinking of taking whether it's a supplement, an herb, a medicine, you want to check with somebody. Is this the right one for you? Because while it could be great for everybody else, there's always somebody that has an allergy or a pre-existing condition or an underlying constitutional weakness that could make something less viable for them. And I think that's really the case with bearberry. In general, very safe herb, has been used by people for periods of time to really help break through chronic cystitis, certainly more than 5 days in a row. But if you have vulnerabilities, you need to pay attention. This may not be the one for you for long periods of time, including 6 days, right? So sit up, pay attention, take advantage of this herb's wonderful healing attributes. You might want to consider downloading my free How Do You Choose the Right Herb for You guidebook. It could begin to help you clarify if this is an herb for you. Then you can go see your healthcare provider to ask appropriate questions, because you want to use things safely. And this is a really wonderful healing herb. So I don't want you to be put off by inconclusive evidence when it could be an herb that could be powerfully important for you. But I don't want you to be a fool and be taking something that could harm you because you didn't pay attention. So there's my soapbox for you. Always low and slow, always be careful, and always consider it an invitation to visit your healthcare provider. Get somebody with a lot of experience who knows what they're doing and can help you make some important decisions whether this is actually the right herb for you. That goes with any herb.